This is my reading review for Chapter 14 of Medical Apartheid. These were my thoughts as I was reading this article as well as other similar articles. You would think that if your doctor is offering you a treatment, device, or procedure, you would believe that it's in your best interest and will result in the best outcome for you. You aren't thinking that you are being used as a guinea pig or aren't realizing that the person with the same diagnosis next door is getting a different recommendation in treatment because of the difference in their skin color. Or even if you are made aware of you being a test subject, you'd hope that this means better outcomes in the future for people who look like you or for yourself. You don't imagine that you are used as a test subject for a product you won't even be able to afford and access in the future. This article delved into multiple examples of either lack of consent at all, lack of informed consent, and as well as racism a lot. We first learn about James Quinn, who was a 50-year-old man who died in 2002 because he was one of the first people to be given an artificial heart in a certain experiment. He was someone who gave consent, but I do not believe that it could be the true definition of informed consent because his idea of what his life would be after the transplant was so far different than what it was or what the doctors really thought it would ever be, but they did not inform him of that. He ended up dying in a way that no person would ever dream of dying from the complications of this experiment. And it was later said by Miss Quinn, his wife, that the patient advocate that they were given to talk about the heart was really a hospital advocate for the company. And so they were coerced unfairly. And while, again, he did give his consent, it was not truly informed consent. As well as the complications that he suffered from, he was most likely chosen for this experiment because of the color of his skin. And since this experiment, there has been a lot of conversation around, while many of the test subjects were African American, in the future, would future African American patients be able to afford or have access to the experiment that they contributed to so much? These questions were never answered, which in itself is an answer, and it just shows the racism embedded in these experiments. They are the people of color are chosen for these risky procedures, but they don't get to actually benefit from the rewards that they are part of. In the next part of this reading, we talk about more the lack of consent at all, especially in the case of artificial blood. Artificial blood is used on patients who are unable to consent because they are unconscious or whatnot, and mostly in the ER. And it's really just a good opportunity for them to test the blood and see how it works because this person is not able to consent, because this artificial blood is also very risky, has a 49% higher death rate than normal blood, as well as, aside from the death rate, there's so many other adverse effects such as shock, respiratory failure, and pneumonia. In the last example, there was a huge lack of informed consent. In this example, there's just a lack of any form of consent at all. These people are not even given the chance to refuse this artificial blood. And we see racism come into play again because there are instances where you can choose a medical proxy to make these decisions for you as they're unconscious. And it is statistically proven that people of color far more often do not have a medical proxy the same way that white patients do, putting them at a disadvantage for experiments like this that are used on non-consenting patients. And then moving on to the next example we have in the reading, it's more similar to the first example, which is where we have a lot of racism and lack of informed consent come into play, where we have Dr. Abbott wanting to test a medical device. And while jobless white men turn their noses up at the disgusting work and paltry pay, through his janitor, who was also black, he was able to find other poor black men who would submit for this study, and they would make 50 cents an hour. And they only probably agreed to the experiment because they were not aware of how invasive or the risks or the harms, especially because not only was he using this medical device, but to track its efficiency, he was subjecting them to a lot of radiation to be able to see what the device was doing. And he did not inform these test subjects what he was doing and how the radiation could harm them. Similar to this reading, I found an article that was about the problem with pulse oximeters and the way that they were, first of all, when they were being created, they were really only tested on people with lighter skin. And of course, in this scenario, we have all the lighter skinned people being the test subjects because it's a non-harmful, non-invasive experiment, while all the invasive and harmful ones, we have all of the minority subjects who are a part of it. And while studies on this have been done in the past, starting in the 1990s, and then again in 2002, and then again in 2005, showing that in patients with darker skin, the pulse oximeter would read their blood oxygen as higher than it was, which can be highly dangerous because they could be reading as a normal pulse ox, and it's actually dangerously low. And this was reviewed and ignored over the years, but then with COVID, pulse oximeters became so prevalent and necessary that it became a real concern for physicians and caretakers, as you weren't able to track their pulse ox as well, and they would have these adverse effects because their pulse ox was reading as normal when it was really dangerously low, and they would find these problems and find their symptoms way later than the white patients due to these pulse ox readings, making their care not as efficient and not quickly received. I found this article on Johns Hopkins Bloomberg School of Public Health, and the name of the article is "The Problem with Pulse Oximeters, A Long History of Racial Bias."